Hello, friends. Personality assessment. So, how will you assess the personality of an individual? So, interpersonal interactions, we are interacting with everybody around us all the time in our life, and in clinical practice, especially when somebody is sitting across you with maybe a changed behavior. So, you are trying to understand his behavior and assess the behavioral changes with which this particular individual is coming to you. So, as understanding personality is an important aspect of assessing human behavior. So, when you think of the different diagnostic classificatory systems in psychiatry, the present day classificatory systems like ICD 11, DSM 5, current TR, that is text revision. So there are a number of classificatory systems. By the DSM Diagnostic Statistical Manual is by American Psychiatric Association, and ICD, that is International Classification of Diseases. The current revision is the 11th, and it is by WHO. WHO. So, in all these categorical diagnostic approaches, the importance of personality is stressed. And practically also, if you want to understand somebody's behavior, it is important that you have a proper assessment of his personality. Again, in all medical specialties or all fields, when we people are interacting with the human beings all the time, so if you know something about personality, the concept of personality, and if you develop some ability to assess the personality of the other individual, it's going to be beneficial in having better understanding, better human relations, and yeah, it also will help you to escape or avoid a number of stresses and difficult situations that may arise from interpersonal interactions. So, among the different the classificatory systems in psychiatry in current practice, the one earlier revision, that is DSM 4 TR. DSM 4 TR is having a diagnostic decision making approach, which is called the multi axial system of diagnosis. So, after evaluating an individual in practice in clinical setting, so you are coming to the diagnosis after proper evaluation. So when you come to that diagnostic decision making, DSM 4TR is telling you to make a diagnosis in multiple axes. So it is a 5 axis diagnosis. So in axis 1, you can give the clinical diagnosis like a depressive disorder, a bipolar affective disorder, a schizophrenia, obsessive compulsive disorder, or whatever. So it is axis 1, you can give the clinical diagnosis. In axis 2, you can give the personality and level of intelligence. So this is today we are thinking about the axis 2 diagnosis. Then the axis 3 is the medical conditions associated. Axis 5 is the social support system, and axis 5 is the global assessment of functioning. So it is the multiple axis under which a diagnosis is made as per DSM 4 TR. So, axis 1, the clinical diagnosis, axis 2, the personality and level of intelligence, axis 3, the medical conditions associated, axis 4, the social support system, and axis 5, the global assessment of functioning of the individual. So if you look at this diagnostic categorization and the multi-axial approach, you can clearly know that if you write the diagnosis in these five axes, it is going to give a clear picture of the individual. So it's very important with regard to human behavior and understanding of human behavior, because the axis 2, that is personality and intelligence, is definitely going to influence the way somebody is behaving. So a behavioral change, say like depression or mania, so it is happening to an individual because of a pathologic change that's happening in the individual. So there is a basic pathology. There's a basic pathology and which is getting itself manifested in the individual as a behavior. So you can see that if 10 individuals are presenting with the depression, so this the presentations, the behavior with which these people present, so the only observable part is the behavior. So they are expressing what they express is the behavior. So we can only see the behavior, that is the expressed part. So there is a basic pathology which is getting itself expressed. So if 10 individuals are coming to you with the depressive disorder, the 10 individuals will have 10 different presentations, because their level of intelligence and personality and the other factors that's described in the other axis of the diagnosis is different for each individual. So if you are having a different individuals with different levels of intelligence, will have different manifestations of the basic pathology which is getting itself expressed as a behavior. So 10 individuals with a depressive disorder will have 10 different presentations. 10 different presentations. So again, your personality is going to influence the way the behavior get itself expressed. So the basic etiology is there. It's getting expressed. It is getting expressed as a depression or mania or something, and the expression is influenced by your personality and level of intelligence. So now today we are concentrating on to the personality aspect. So how will you understand the personality of an individual? So practically, so there are different definitions and approaches and explanations for personality. For personality. So personality, the shortest possible explanation is to say that it's a sum total of the individual. So it's again an all-inclusive, very short definition. Again, it's difficult to give some clarity in a one-to-one situation or in a clinical situation. Another definition is to say that it's the enduring patterns of behavior that characterize an individual. So they are talking about patterns of behavior. So from history, when talking to the individual, you can know what was happening or how he was responding or reacting to different demands of life and environment, and how he was reacting to that. So if and behaving and how he was responding and what was his attitude, how his attitude changed based on different demands in the environment. So that if you can get a clear picture of that, that will show you the patterns of his behavior. And so this definition, that's deeply ingrained, enduring patterns of behavior that characterize an individual. So, and again, when you say deeply ingrained, it is saying, so it's having a genetic basis, almost a genetic basis, because it's written on all your cells from birth to death. So it's going to influence you, and it's lasting, and it's definitely influenced by environment. And as an individual from birth to death, as he is growing up, there is constant interaction with this genetic coding and the environmental factors, and this constant interaction is again going to shape the individual to what he is now. So, by knowing his past, by knowing his past reactions, knowing his patterns of behavior, so you can have a reasonable assessment of personality. And again, so the concept of personality, so we have to understand that the concept, then only we can have a clear understanding of the personality of the individual by looking at his patterns of behavior or his previous responses and other factors which I was mentioning right now. So, the concept, there are different concepts. So, I am telling something, okay, that's not there in all accepted classical textbook as well, and my thoughts on that as well. So, you don't have to look at it as at its theoretical perfection. And I am warning you and I am telling you that you don't have to accept it as such, and you can have your thoughts on that, and you have to know. So again with human behavior, it's very difficult to put it into very concrete ideas. And as the Gestalt psychologists say, 1 plus 1 is not 2 with human beings. There is always some unexpected twists and turns and uncertainties in human life and behavior. So I am telling you, so what I am telling you in this video need not be accepted fully or taken it for the theoretical perfection of it. So you also can definitely think about it and can form your own ideas. So the abstract concept of air, fire, water, the Indian thinking on personality, the air, the fire, and water, and water. So many people, when hear this, may may start thinking that it's all absurd and so, but there is something in it. So the air influenced personalities. They are kind of people who are very energetic, moving from place to place, moving from people to people. So always there is different ideas coming to them. So they are very quick to make friends with people. They are all energetic and may appear euphoric. So that type of moving, quick, people who can quickly understand people, but they may not be very good in keeping lasting friendships and relationships, and they may appear opportunistic. So they go from one person to other, one group to other, one nation to other, one place to other, one job to other. So they are quick people, they appear pleasant, energetic, moving about. That type of people is the personalities who are said to be influenced by the air character. So the other group is the fire character. So the fire character are people who are having lot of inner energy, lot of fire inside, lot of inner energy. They understand things quickly. It is said they eat well, so they are active. They can digest ideas quickly. Again, there's a never-ending source of energy inside them. And so they may not be that quick movers like the air people, But the fire people, the fire personalities have a lot of energy, and they relish food, so they eat well, so no, so they, and at the same time they digest not only food but ideas, and this type of people are the fire people. They may appear a bit sedentary compared to the air personalities. And the other is water personalities. So they water personalities, they appear as maybe the earlier classification type A, type B. The type A may be the air and the fire group, and the fire group with some air character, maybe the earlier classification of type A personality, were very active, going about, doing all kind of things. The water personality, that is the third. So they are more sedate type of people. They appear very calm, and they appear to some extent lazy, and but the perseverance may be good in them. So if you are setting themselves to a task, if they are setting a task for themselves, so they will do it. So perseverance is not about short-term tasks; it's about long-term ideas. They appear very sedate, and it takes time for them to accept an idea. They sit and think a lot. They move slowly. They appear lazy, and so they are not good movers, and they are not very energetic. But one quality with them is perseverance. So this type of classificatory approach of seeing different human behavior with your air, fire, and water characteristics that is influencing your personality. So another again useful approach is to see the helpfulness approach. In the helpfulness approach, so when we are taking care of a child, so we can view it as we are trying to help the child, because an adult, so in an adult child situation, adult is a dominant person, and the child is helpless, an young child is helpless. So you are helping the child. It is your helpfulness that is helping the child to grow up. And the position of the child is something of a helplessness. And irrespective of whether you are a child, whether you are in your youth, or you are an elder adult, the sense of helplessness and helpfulness occur in the same individual. So when we are falling sick, so we are kind of looking for helplessness. So we appear helpless, so that we are expecting others to help you. On the other hand, when you are working, when you are doing something, it is as if you want to help somebody. So the helplessness and helpfulness, so this will the game of helplessness and helpfulness is in constant play in all human interactions, and it is very very basic. So how much you use your helplessness or helpfulness in managing a situation can to some extent decide your personality. Again, another concept not directly connected with the personality concept, again with psychology people, it's a very familiar explanation that everybody may be familiar with, is the locus of control. So so where is the locus of control of an event happening in your environment? So, as an individual, if something is happening and you are looking at that and you develop your own understanding or perception of the event that is happening there, and if you are thinking you are responsible for everything that's happening to you, so we can say the locus of control is inside you. So definitely something happening in the immediate environment of you is happening because of multiple factors influencing it. It's not you are making all the time. And there are things which you do, but there is a clear environmental influence or the influence of the surrounding. And there are multiple factors are influencing to get an event to get precipitated. So when something is getting precipitated, some event is happening. If you start thinking that you are responsible all the time for everything that's happening to you and around you, so we say that the locus control is totally inside you, totally inside you. On the other hand, if you are saying that everything that's happening to you and around you is the result of the external influences and you are not responsible for that, when we say that that locus of control is totally outside, so there's problems for that if you are going to the extremes. If you are keeping your locus of control inside you all the time, you will start blaming you for every wrong that's happening around you. So, and you will be pain, you will be feeling excessively guilty. So that's not good. And if you are putting your locus of control totally outside, so you may not take any responsibility for anything that's happening around you. You will simply say that I am not responsible because it's happening because of others are doing it. So again, that's also not a good position. So depending on the situation and where you place your locus of control, so again that is going to influence your personality. So if you are seeing an event logically and in the correct perspective, knowing about the locus of control, knowing about the different factors that's influencing in an event getting precipitated. So you are having a strong, mature personality compared to people who go to the extreme by either by putting the locus of control entirely inside you or the locus of control totally outside you. So this is again another factor that you can see when you talk with people in helping you to understand him as a person and or his personality. So, so there are a number of more dimensions and classificatory systems and explanations about personality. But I think so. I passed 23 minutes, and I think it's good for today. And see you later with another video. Okay, thank you.